So part of the reason you want to get a screening lab before you start losing weight is that you want to know where you're starting from. So if your liver already starts off sick, you need to know that before you start losing weight, because if things progress, you want to be able to catch it. Versus if you start off okay and then while you're losing weight, you start getting worse, that means you've started and ended at a slightly different point. So before you start any sort of exercise regimen, before you start any fitness regimen, if it's a new thing for you, you always want to see your doctor first. Alcohol-induced hepatitis. How do you avoid it? Drink only socially, and most doctors will tell you don't drink any more than 1 to 2 servings of alcohol per week at maximum. Better yet, there's even more data coming out that's suggesting it's probably even better to just not even drink at all. And that's not just from a hepatitis standpoint. So treatment across the board. Once you have liver damage, you need to avoid things that are processed by the liver. Your liver does a lot of processing of medications and toxins, and so anything that you can reduce things that put stress on your liver, the better off you're going to be. So one thing that people commonly take that is processed by your liver, yes, jalapeno, you are anxious today, is Tylenol. Acetaminophen is the generic. This is processed by your liver. Certainly, be careful if you take Tylenol for pain. You don't want to overdo it. If you have hepatitis A, B, C, D, or E, or you have autoimmune hepatitis, or you have NASH, don't drink because you're now just putting a load on your liver. And then don't take any other medications. Yes, dear. Don't take any medications without clearing them with your doctor first, because there are a lot of medications that are cleared by your liver that you may not even be thinking about. So some antibiotics, many chemotherapy meds or immunosuppressive medications, and a lot of anti-seizure medications are actually cleared by your liver. So treatment. Hep A and Hep E, it's usually supportive, and by mean that, just don't take anything that's going to be processed by your liver, IV fluids if you need them, and eating a healthy diet, and just generally getting through the infection. So Hep A and Hep E, you usually don't have to do anything unless if you go into full-on liver failure. So you're somebody with who is really sick to begin with, or you're a pregnant woman. And if you go into full-on liver failure, it's getting on the transplant list. Hepatitis B, there are some antiviral medications that slow down the division of the virus itself. So this is going to work either on DNA replication or something that works on your body called interferon, which works on your own body's immune response and ramping up its response against the infection. Levels of success vary. So some of these work really well, and it's getting better than it was when I was in medical school. They're also really expensive, and since some of these treatments are newer, unfortunately, a lot of insurance companies aren't picking these up. If you have chronic hepatitis B without complications, you do okay. You've always got in the background that your disease might progress. But if you've just got the virus, you're just kind of sitting there with it. If you progress to liver failure, cirrhosis, or whatnot, then you have to get on the transplant list. Yes, dear, I know. We'll take care of you. If you get liver cancer, then in addition to all those other worries, then you've got the whole sequence of chemotherapy, radiation, surgery, all of which, by the way, suppress your immune system while you've got a chronic virus inside you. And this is also true for people that have hepatitis B and D simultaneously. And this is going to sound very similar if you have Hep C. The treatment is the same. Antivirals to slow replication, medications to speed up your own immune response, and we'll finish this part up when I return.